Kathleen and I'm the respiratory therapist student, and I'm going to be doing a tracheostomy care video today with Hello Kitty. So before we get started, I just want to talk about trach care in general. So trach care is basically like a type of procedure that we do for any patient, neonates, pediatrics, adults, and we do trach care to maintain without the patient having any bacterial infections or anything that can progress into like a worse state in their disease process. So we do this like in the most sterile environment as possible, and we do more than just trach care. We change their tracheostomy tubes, and we also change like their tie that goes around their neck. And of course, we keep supplying them with oxygen throughout this whole procedure. So there shouldn't be any pain involved, but if there is, we just have to let the patient know that we will be helping them either way. So here are my tools I want to use today. Okay, so we have our sterile water, our hydrogen peroxide. You can also use this little tube to mix them both. It's like half and half of each. Sterile Q-tips, sterile gauze. We have our gloves over here. And then we have some sterile other gauze that we need in case. And then we have our replacement for the necktie. She's still on her trach collar. As you can see, her trach is right there. And we have our ambu bag, just in case we need it. And yeah, so we'll perform some trach care right now. Okay, so assuming that I have washed my hands, I am clean and sterile, I want to put on my gloves. We already identified the patient. She is the correct patient for this procedure. Mom already approves of this whole thing, so she is here with us and she'll be watching just in case she gets agitated, which she shouldn't. I mean, it's just a quick procedure. So we're assuming she is on oxygen. We will gently take it out or move it to the side. And then I'm just going to take it off. I'm going to put her trach collar to the side. And now we just have to remove the drainage, her old one. Next, we'll just look at her trach to see if it's soil on the side or if it's ripped or misplaced. So far, it does need like it needs like a little trach care. So what we're gonna do is we're gonna mix our sterile water with our hydrogen peroxide in this little cup. And each of these Q-tips is like a one-time use. So once we use it, we just have to throw it away. And there's a technique to use. So what we're gonna do is we're gonna take the Q-tip. We're gonna go from, I guess, the bottom down. So we're gonna start from the center. We're gonna like scroll our way towards the outside. And then we throw this Q-tip away. We're gonna use a new Q-tip. And we're gonna go on the other side. We're gonna go under the trach. We're gonna scroll and do like a little scrubbing motion towards out the end. Now this is discarded. Get a new one, and then we're gonna do the same thing on the top. So we're gonna take the Q-tip. We're gonna go on top of the trach. We're gonna do the same thing. We're gonna scrub around the area towards a one-way motion towards the end. Throw it away. Get a new one. same thing. So you dip it in sterile water and hydrogen peroxide, nice and clean. So what we're gonna do is we're gonna hold the trach, go under, and we're gonna scrub one way and then out, like that, and discard. Okay, next, if we see the tie, if we see it, if it's like soiled or anything, then that's an indication for us to change it. So let's just say hers is dirty and we want to change it to a new one. So I'm going to show you guys a photo of what the actual trach looks like, because obviously I'm not going to puncture Hello Kitty, but this is just a fake one. Usually the trach has like a little like hook after it. So once we take it out, there's going to be like a hook coming out, and then we replace it with the same number and the same ID, and we look at that over here on the right side of the trach. It would have an ID and inner and outer diameter of the trach. So we literally have to stay with the same size. All we have to do is just take it out and replace it with the new one and put it the same way. We would always have 2 people in the room while doing this procedure, so I'm not just going to be the only one, but we're going to have an extra set of hands to help us. And so just assume that we have a trach there, like the real one. But I'm going to change the collar. So what we're gonna do is, let's say we have another person holding the trach in place while I remove the tie. And since I'm only using house supplies, we just have to assume. So somebody else will be holding the trach. As you can see now, now the trach is loose. We're going to lift up her head real quick. So now we discard this one because it's soiled. Somebody will hold the trach in place, and we're going to replace it with a new one. So in order to replace the trach, so let's say, as I said before, we're gonna take it out. So we're gonna remove it, right? We're gonna remove the trach, and it's gonna have like a hook. You discard it, and now all of this is open, right? So then we put in a new one. So a new trach with the hook, and then the obturator will be inside, and that will help us guide us to have the trach to go inside, back in the patient. So let's say we have an obturator here, we'll literally use it, and it will help us guide us to go in. There's gonna be jelly around the tube, so it's gonna help us get in there easier. So once the trach is secured, we're gonna have the other person secure it with their 2 fingers, have it still, because we have to assume that the child or the baby will start moving, getting agitated. We don't want to lose that whole or secure trach. So what we're gonna do is put a new set of trach collar, and we're assuming that I'm doing this 2 hands, but I'm supposed to have another set of hands, but we're assuming at this point. And these are Velcro, like the real ones are Velcro. So this won't be an issue. Literally, it would just go and it would just strap on. So now we still have the trach in place, right? We have to make sure it's not too tight. So we would go with her pinky, and we would go under the trach. If it's too loose, it would feel loose. So all we have to do is just tighten it a little bit more, and it has to feel like snug. Shouldn't be too tight nor too loose. Okay, so now we have it secured. So what we're gonna do now is put a sterile gauze. It's already cut in half, so it's easier for us to use. All we're gonna do is use this You can use another sterile Q-tip to snug it in, or you can just do it like this. Just like that. And then once we have that in place, we will give her some more oxygen, because this whole time she had no oxygen. We're just gonna help her out and give her some. And just like that. Thanks for watching, and I hope you liked my video.